Okay, so this is my lecture. So when we talk about the challenges, what are the challenges that y'all face every day? There's a lot of them, unfortunately. The number one thing, lighting. I mean, I think that's an easy thing to fix, but poor lighting is a challenge. Magnification, space, okay, the lack of a quality space to put your stuff. How high is your table? You guys all work on wet tables, don't you? They're designed to be used for when you are standing. Exactly. They're not designed for dentistry when you're supposed to be sitting. Okay? Your chairs probably suck. You know, those $15 chairs from Staples are not ergonomically very good. Your organization, we'll talk about that because, you know, if you're getting up and down and you're bending over and you're doing this and all that kind of stuff, over time that plays a role. Your equipment, number one? Non-existent. Exactly. We don't. What can you hand me? Oh yeah, we don't have one of those. Yeah, we don't have it. No, that one's broken. You know, it's like, yeah, it doesn't really help. You know, the non-existent, the different, because you may be used to luxating elevators as opposed to standard elevators. Dull. Dull, 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 dull. Broken, twisted. You know, looks like corkscrews, all that kind of stuff. They don't work really well. I honestly believe that the average client walked in and looked at the equipment that we are using in their dog's mouth, they would say, yeah, no, you're not working on my dog with that equipment. Personal protective gear, again, not an ergonomic thing necessarily, but it is a staff safety thing. And then staff, I mean, it's tough to get good staff nowadays. A lot of them have zero training, right? I mean, you guys got no training. And then, of course, unfortunately, when you get no training, it takes you 10 times longer to do everything. You maybe don't do it correctly. And then they may or may not be indifferent, you know, to your cares and what's going to help you, your patient, and yourself. So what I'm going to do in this lecture, and it's probably only a half an hour or so, is I'm going to take you through these different issues, why they're an issue, and some simple ways and some not so simple ways and how to correct it. Because some of these things would be incredibly expensive, like $50,000, $100,000 to fix. Some of these would be $10 to fix. So, you know, you as a technician, you know, you may not be able to do this. As an office manager, hopefully you would. As an owner, you obviously could if you chose to. So I'm going to take you through lots of different options, things that have come up. And again, it really comes down to the fact that I've started looking at this. And when you start looking at this, you're like, wow, there's these things that we can do. Okay, so the physical plant. We're going to start with that. Lighting. When you can't see, you can't work. And the thing about lighting, poor lighting, most practices, if you don't have a really good light over your dental table, not only is it eye strain, I mean, that's probably the big one they talk about on the human side. If you don't have proper illumination on the human side, then you really can't see very well. And not only does it take longer to do the procedure, you miss stuff. So again, it's not even just ergonomically for you, it's also bad for your patients to be able to do that. So if you've got good lighting, not only is that good for you, it's good for your patient because it allows you to do better care, and it also allows you to do better care more expediently. So therefore, you're going to be able to do a lot better for your patient a lot faster, which is better for everyone, and you're not going to miss stuff. I mean, if you don't have good lighting, you're going to miss those minor chip fractures. You're going to miss those minor pockets. You might miss a little growth. So the good lighting is really good for everybody. What are our options for that? Well, obviously a good surgical lamp above your dental table would be really nice. If you guys have, or if you go and you watch the ergonomic videos that we've posted on our website through our YouTube, and if you don't have that, I have a link to it later on, is that having something directed on your head is much easier to direct into the mouth, especially the back area of the mouth, that you may not be able to see with a good overhead one. So a good overhead light is really nice. Oh, by the way, they do make some really nice lights that don't have the shadow effect. anymore. That's what we're putting, the ones that we have now. I really like the Centurion spots that we have. I don't get paid for saying that, but I do like them. My residents like the ones that have multiple things that come in from all different angles, so they don't get the shadow effect. So that's even more helpful. But let's say you work in a practice that's not going to invest in a $1,500 surgery light, yet you want to be not cranking your neck. You want to take care of yourself. Well, that's $30 from Amazon. It's a hiking head loop. Is it exciting? No. Is it sexy? No. But it works, and it's cheap, and veterinarians are cheap, and it's something that you can actually expense and probably get away with. Clampable desk lamps. I mean, those are dirt cheap too. They're not as good. I mean, if you guys aren't going to get a good, nice light, or you're not going to get, loops, this would be the thing that I would recommend, hiking head loops. We used them for a few years. But honestly, the lights that come out of the loops are amazing. And loops are really good for two things. Number one is lighting, and the next thing we're going to talk about, maybe I think it's in that order, is magnification. Look at Ashley. This is Dr. Greer. Look at her posture here. Her posture is perfect. Okay, that's the one thing, is you got beautiful light. You can see really, really well. It's directed right where you're looking, as opposed to, sometimes the lights work well, sometimes they don't. But the place that you're putting it is really good. This is, and again, this isn't Dr. Niemiec talking. This is every article that I read on human ergonomics and how you can take care of yourself to decrease the number of repetitive motion, ergonomically caused issues by far. And I mean by far. Number one, magnification. Orders of magnitude. Why? What is your go-to thing when you can't see well? That, right? When you do that, when you do this, that is horrific ergonomically wise. Okay? So when you have poor magnification, you don't have magnification, this is what you look like. Your neck's down, it's stretched out, your back is down. Not only is this bad for you, again, a lot of this is synergistic. Not only is this bad for your posture, for your neck, for your longevity, for your overall health, it's also really, really bad for your patient, because you are going to rush things, because you are going to miss pathology, because you're not looking well enough. Loops make a massive difference because it makes you sit up straight, especially if you get really nice ones. I mean, we all have the Innova ones. They're great. You don't have to get them. They're less expensive ones. It's fine. But what they do is they measure you, and they say, what is the focal length that you want? And then you set it up, and it's magnified, and it's focused right there. So not only, I mean, a lot of the things that come out of it are, you get better vision, so you do better for your patients. You're faster. But the biggest thing to me is it makes you sit up straight, because I'm telling you, if you lean forward, which is your fallback, that's what you're going to do. When you can't see something well, you're going to lean forward, and then it's going to go completely out of focus. You're not going to see anything. I will be honest, it will take you 6 months to get used to wearing loops. It will. You will look over them. I did. Okay? You have to train yourself to look through the loops. And I will tell you from a personal side, swear to God, I'm not paid to say this, I did not know my back was getting sore from doing surgery. I didn't. I just assumed, and how often do we hear this from people with their dogs with bad gum disease? I thought I was just getting older. Back pain is something that happens, right? And when you get to be 45, your back starts hurting. Guess what? I got loops because my accommodation started going away and I couldn't see quite as well. I got loops, and within 2 months, I was like, my back doesn't hurt anymore. Why? Because it made me sit up straight. If you guys are looking for one thing to make your life better, it's magnification. And again, it can be something relatively inexpensive, like jeweler's loops or something like that. That will still have the ability that it's not going to be perfectly aligned and make you sit up straight. But anything that you can do to force yourself to sit up straight is going to make a big difference. So now this is what my residents look like when they're working. And they can see better than they could if their face was down here. So if I had one investment that you could make, it would be magnification. You can get some inexpensive ones that everyone can share as technicians, but having your own are just amazing. Space. We already talked about this. Most of us that are doing this are doing it on a wet table. That's designed to be used standing up, not designed to be sitting down. You don't have a space for your knees. You don't have the correct height. You don't have anything set up. So again, Alan talked all about this. I'm not going to talk about Levo anymore. Something like this if you don't have the proper wet table. Speaking of which, table height. Is the table too high? Is the table too low? Can your chair effectively work on these tables? Again, here's Ashley working on a chair that's way too high for a table that's way too low. She's bent over, her neck is bent, her hands are off. These are miserable. So you don't necessarily need to change your table. But what you need to do, if you can't change your table, I mean, ideally you be able to get your knees underneath it. If you can't get your knees underneath it, I would make a little investment. But if the big problem that we see all the time is that the chair and the table don't match. It's much more expensive to change the table than it is to change the chair. So change the chair. So if you have an issue and you're too cheap to buy a new chair, put a cushion on it if you're too low. Okay? Make sure the chair can go low enough if you're down here. If it can't go high enough, put a cushion underneath it. And again, you want to be in this situation where you have a 90-degree angle. Your back is straight up and down like that. Chairs are another thing that can make a huge difference into your ergonomics without breaking the bank. They're not free. They're not super cheap. Like, the really good ones are probably like $600 to $800. I mean, they're not horrible, but they're not cheap either. But the problem is, again, this is a table. This is our Las Vegas practice. So this is Ruth, my associate, my resident technician in Vegas, and this is one of the chairs they use. And look at how far she is away from the patient. She's going to have to lean over. Her knees don't go underneath there. So this table isn't bad, but the chair doesn't match the table. So make sure that when you get a chair, that chair matches the table. And again, it all goes back to back issues, reaching up and down, and then this discomfort's going to make you want to go a lot faster. So if you're too low, add a cushion or two. Saddle chairs, I will be honest, I hate. I will not sit in a saddle chair. They make my life miserable. All my residents, Dr. Skinner, love them. So again, saddle chairs are another thing because of the way they're designed. It makes you sit up straight. If you lean forward in the saddle chair, you fall. Okay? So the saddle chairs, if they're correctly designed, make you sit up straight. So again, it's another thing, and maybe that's why, because I use loops. I don't need a saddle chair to force me to sit up straight. So, but if you have a saddle chair, and again, Midmark sells these, a lot of different companies sell these, $600-800 would be a reasonable amount. All my residents swear by them. Most veterinary dentists swear by them, and I have heard multiple veterinary dentists say that when they switched to a saddle chair, their back pain went away. So I think it's a whole nother thing that we can do, and again, relatively inexpensively. Finally, and Debbie Boone, if you guys don't know that name, she's quite famous in the practice management session. And oh, by the way, she and I, if you guys did not know this, are speaking next week at AHA here. If you did not know, AHA Con is here at the Convention Center. And I will be speaking on Friday morning. Debbie, I think, is speaking at the same time I am. But she does a lot of this when she talks about building a practice. Because again, what we mostly do are use the things that we've always used, and you might be bending down like this to get your extraction force in. You might be going up like this. If you have it all set up so it's in arm's reach, or at least for your technician that's monitoring that's in arm's reach, it's going to make a big difference. The other thing that drives me up a wall is when my staff doesn't know where things are at. Because then you're wasting time under anesthesia, it's stress on everybody, then you're rushing, then everyone's looking. Organize everything and have somebody in your practice, ideally the office manager or your lead technician, go in, organize everything, put everything in a place that it's supposed to be, and label it. And say, gauze goes here, extractions packs go here, vet spawn goes here, because when you need vet spawn, when the blood is hitting the ceiling, you need vet spawn now, okay? So organize it, have one go-to person that knows it, your lead technician, and then that lead technician should train all the technicians where it goes, and it goes back there. Now the problem is, like I have in a city that will be named nameless, I have two very OCD technicians, and my OCD technicians don't agree on where things belong. So they always put them in different places. Even though they're labeled, they put them in different places. You guys have got to agree, because if it's organized, then everyone can find it. There's not this up and down and searching and all that kind of stuff, wasting time and being ergonomically incorrect. Okay? So again, everybody should familiarize themselves with where things are at. Organize it yourself, doctors. And again, as a practice owner, as a manager, you go, it's my way or the highway. This is where we want it. Now again, you can come to a consensus as to where the stuff goes, but you've got to have a place it goes. All right, equipment. Okay, and again, we talked about all these problems, non-existent. Okay, if you don't have the equipment, if a lot of places just don't have the equipment. Now again, if you're in a general practice, you own it, you're there every day, you know what you have versus what you don't have, what it is. But if you're going in as a relief doctor, or if you are, doing a rare procedure, before you anesthetize the patient, go, do we have everything we need to do this procedure? The big thing is, though, and when we talk about equipment, old, dull, damaged. It's not good for your patient. It's not good for you. It's going to lengthen your procedures. It's going to lead to way more complications, and it's going to damage your patient and you. Okay? So if you are the clinic owner, I'm sorry, guys. You need to have got equipment. You do. Dentistry forever has been, and we do dentistry. We have this beautiful surgical suite. We have this beautiful sterilized equipment. And then in the corner we have this sterilizer, and we have this, this cold sterile tray that has a couple things in it. That's not good medicine. It's not. Dentistry is a revenue generating place. It needs to be done correctly. If you are a relief vet, I do actually recommend that you buy your own and bring it in if the places that you're working is bad. So one thing that, again, came out of my research, the number one thing by far and away that improves ergonomics is magnification. Number 2 is good lighting. Number 3 is proper equipment. And it just so happened, serendipitously, that my new resident from Brazil was here when I was talking about this and putting this lecture together. And she's like, oh my God, I have a lot of wrist fatigue and a lot of chronic wrist issues. I switched to titanium instruments that are much lighter, and a lot of my pain went away. So there are several companies. Germed, G-E-R-M-E-D, is this company. We have a couple of their stuff up front. Again, I don't make any money if you buy it. I don't care if you do. But these are titanium instruments that are much lighter and much more ergonomically sound if you're doing a lot of oral surgery. And they're just lighter and easier to use, especially the needle holders, because you're doing a lot of suturing. Okay? Different, again, if you're going from practice to practice, learn how different things work. Elevators work different than luxators, than winged elevators. So learning with the different types is really important. I mean, this is serious old school, but I'm telling you, it used to be used. Some veterinarians still use this. Dentistry is kinder, gentler, minimally invasive, small, sharp instruments. So, just so you guys know, really quick explanation on different things. Okay, elevators, standard elevators, are blunt at the tip. They're used to stretch the periodontal ligament. Okay, they're not going to cut the periodontal ligament. So you get it between the tooth and the gum, and you twist, and that twisting tears the periodontal ligament. In my experience, in my personal opinion, using standard elevators takes about half again as long to take a tooth out as using a luxating elevator, because luxating elevators actually cut the periodontal ligament as it goes in. Okay, this is what I recommend. They're smaller, finer, sharper instruments, and so you push them in and they cut the periodontal ligament and they luxate the tooth out, as opposed to a lot of twisting. Again, elevators are fine. Wing elevators are fine. But I really find that especially for cats, these little tiny 1 to 2 millimeter luxating elevators make a big difference. You really should only be using small breed extraction forceps. If you're using big extraction forceps, it's going to put too much pressure on the tooth. You're going to damage your wrist. You're going to break roots. You should only be using small breed extraction forceps to actually think about plucking the tooth out of the extraction site. Okay? Poor condition. I mean, in human dentistry, they sharpen their instruments between every patient, or at least once a week. Those scalers, those curettes that are being used on you when you go get your teeth cleaned, they've been sharpened within a week. The average veterinary practice doesn't sharpen at all. And if you're not sharpening your hand instruments, whether it's a luxating elevator, a curette, or a scaler, within a month, they're dulling. Within a year, they're kind of worthless. And the problem is, we're still using them. And the problem is that old, dull instruments cause so many issues. I mean, ergonomically, instead of like tick and doing one stroke and popping off all the tartar, you're going over and over and over and over and over. So again, it's causing your wrist to have some problems. It's causing your neck, causing your back. It's lengthening your anesthesia. Not good for anybody. Not good for the patient, not good for the practice owner, not good for the technician, not good for the doctor. You're wasting time. Time is money. And then, oh, by the way, you're not cleaning the teeth effectively either. You're just not. So if there's the number one thing that I would recommend as far as ergonomically would be magnification. Number two, well, actually, we'll get to this in a minute, but number two is stretching. Okay. Number three is lights. Number four is proper equipment. Those are really the big things. Then after that, you can start talking about chairs and tables and table height and all that kind of stuff. But if you fix those other things, magnification, lighting, proper equipment, and stretching, which costs this much, okay, you're really going to make a big difference. So these things cause way much more, if you got a dull instrument, way more iatrogenic complications and way more effective and longer surgeries. So if you have not sharpened your instruments in a long time, there's basically two options. You're not going to be able to get it sharpened with a sharpening stone. You can either buy new, which is what I'd recommend, to be honest. Get a few new scalers, curettes, luxating elevators. Or we do have a sharpening service. Dr. Skinner actually sharpens the instruments, or one of our techs. We have a honing device that we can actually get them back to a nice sharp insight. We don't sharpen scissors or anything like that, but curettes, scalers, luxating elevators, getting periosteal elevators, getting them back to a nice sharp edge, I'm telling you what, it works so much faster when they're sharp. But buying new ones is an important thing. How do you sharpen? I'm going to come up with a whole class on this at some point. Oh, by the way, if you really want to learn how to sharpen, we just announced in January we're doing our dentistry in a day, which is really inexpensive, to come and get 8 hours of CE, and we do teach sharpening in that. It's the last Sunday of January, so it's a good investment for CE. But how do you sharpen a scaler or a curette? This shank here, the shank is when it's parallel to the tooth is when it's engaged in the calculus. So when you put the shank on the tooth parallel, that's when it's working. So what we do to sharpen it is we put it on the instrument the way it's supposed to work and then bring it off 20 degrees. So if you imagine this was on the instrument, on the Arkansas stone like this, if you bring it off 20 degrees, oh, by the way, 20 degrees is a peace sign. That's 20 degrees. Okay? When you're off 20 degrees, you just go back and forth. Just like sharpening a knife. That's all there is to it. Gets it back to a nice sharp edge. Scalers, you sharpen both sides. Curettes, you only sharpen the one. For luxating elevators, what I recommend is what's called a conical stone. The conical stone has that curve in it, so it kind of matches that. So how do you do it? You angle again 20 degrees. Some people take sharpen the outside. I like sharpening the inside, and just do 20 degrees, and again back and forth until it feels nice and sharp. Okay? Burrs. Now, I used to say they cost $1. That was pre-COVID. But I will bet you that these burrs probably cost about $2. Okay, about $2 is what a burr costs. Again, that's from Henry Schein. Henry Schein, I know that there was another company that shall remain nameless that was a lot more expensive, but Henry Schein, like 2 years ago or 3 years ago, was selling these cross-cut taper fissure burrs for about $1 a piece. Okay, here's the thing about burrs. When you're using a burr on a tooth, in 10 seconds of actual cutting, not spinning, but 10 seconds of actual cutting on bone or tooth, that burr is already becoming dull. In 1 minute of use, it's almost worthless. So the problem is we, as veterinary practitioners, tend to use them way too long. And you're seeing smoke, and you're smelling that burning thing because you're using a dull burr. The problem is, when you use a dull burr, number one, you waste time. What's the most important thing or most valuable thing in any practice? Time. So number one, you're wasting time. Number two, because you're burning your patient, you're damaging your patient, right? Number three, when you're putting more pressure on that drill and it's taking longer, you're damaging the turbine in your high speed. Your burr's about $2. The turbine's about $400. So now you're damaging a $400 turbine to save a $2 burr, and wasting time, and damaging your patient. But more than that, you guys know when you're using your high speed and you hear the compressor kick on, okay? Every second that compressor runs is another mile on its odometer. So now you are damaging a $7,000 compressor, a $400 turbine. You're damaging your patient, you're damaging yourself, and you're wasting time to save a $2 burr. Use new burrs. Always use new burrs. Now again, if I section one tooth, am I going to use it for another patient? Sure. But if I'm doing full mouth extractions in a cat, I'll be honest, I'm probably using 4 burrs, maybe 5. Once you've used it for about 30 to 40 seconds, throw it away, put a new one on. As soon as it starts slowing down, if it's not hot knife through butter, you need a new one. They're cheap, trust me. Okay, and if you can't find them for less than $10 a burr, you need to find another distributor to get it from. This is a coarse diamond burr. This is what I use to smooth out the bone after I've done an extraction. They last longer and they are more expensive, but these carbide burrs, throw them away. Okay, ultrasonic scalers. Okay, when you're using an ultrasonic scaler, I'm sure many of you have heard this part of this lecture and the perio part. But when you're using your ultrasonic scaler, it's a mini jackhammer. It's pounding on that tooth, okay? About 30,000 times a second, okay? It's dulling that. It's wearing away over time. So studies have shown when you lose 1 millimeter off the tip, you lose 25% of your cleaning ability. When 2 millimeters are gone, you've lost 50% of your cleaning ability. What does that mean? It's going to take you half again as long to clean the teeth. Again, you're in a bad position, you're bending over, it's bad ergonomically, it's bad for your patient because they're under anesthesia half again as long, and it's bad for the bookkeeper because they're under anesthesia for twice as long. So for all these things, my ex-girlfriend really talked about the fact that proper equipment is ethical. It's ethical for your patients, it's ethical for you. These things cost, and again, I don't know, I haven't bought one in a long time, but let's say $100. They should last a month or two in a busy practice. So what I recommend is you buy a new one, okay? And about once a week, maybe once every other week, you have your technician compare the length of it. When 2 millimeters are gone, throw the old one away, put the new one on, and buy a new one, okay? And then compare that one. They also have tip wear guides as well, but I like this. That's simplified. It's not a challenge at all, okay? PPE, is this truly ergonomic? No, but it's important. When you are doing an ultrasonic scaling, especially ultrasonic scaling, to a certain extent your high speed will do this as well, but mostly it's the scaling. You are generating so much aerosolization of bacteria that is going into your eyes, going into your lungs. I can't tell you how many studies or how many reports there are about human hygienists with pneumonias and all that kind of stuff. And again, some of that's human to human, but the bacteremia that's being spread is horrific. So always wear a mask. I'm a big believer in eye protection too, because it gets there, a piece of tooth breaks off, hits in the eye, that's going to ruin your day. Gloves, technicians, how often do you get scratched, cut, bit, or poked? Every day. And then you put a nice new wound in a cesspool. Doesn't make a lot of sense. And then finally, what we have determined, and this was a new thing relatively when I was doing the research for the perio book, just doing an oral exam showers you with bacteria. So your clothes are coated in bacteria, and then you go into isolation. You go into sterile surgery. Okay, and you're spreading that bacteria throughout your entire hospital. Oh, by the way, also through your ventilation. All that bacteria is going everywhere. So that's the bottom line to say is that you should be taking care of yourself, taking care of your patients by protecting yourself. Okay? Getting towards the end here of my lecture part of it, staff. Okay? Really it comes down to, and I know it's hard to get good staff nowadays, trust me, I get it. But really lack of training. One of the big things is if a staff doesn't have good training, not only is it bad for them, because again, they're going to spend a lot more time doing cleanings, doing x-rays, doing extractions, all that kind of stuff. It's bad for them, but it's also bad for the patient, and it's bad for the company. Because again, I hear all the time, and it drives me crazy. Oh yeah, well, we do 5-hour dentals. And I'm like, why? And they're like, well, it takes 2 hours to get the x-rays. Why? And it's like, well, because they haven't been taught. And of course it's going to take that long. So from the standpoint of poor training, if it's taking you really 3 hours to do a cleaning in a medium-sized dog, it shouldn't take more than 45 minutes. It really shouldn't. And that is causing a problem from the welfare standpoint. It could be illegal, although I think it'd be kind of hard to fight that. But it's just stress for everybody. So getting training, whether you guys do it yourself, whether you send them here, whether you send them someplace else, or you do something online, if it is taking your staff more than 10 minutes to take full mouth x-rays of a cat, and more than 15 minutes in a small dog, and more than 20 in a large dog, you're going to get some training. Because I'm telling you what, it's a waste of, and again, what do we talk about? What's the most valuable thing in any practice? Time. And then what is everyone freaked out about anesthesia? Time. So if we can get more efficient, we can get it and really train. In different staff, docs, if you're doing a lot of dentistry, find someone that likes it. Find a technician that likes dentistry. Make them your lead tech in the dental department. Say, Sally, Joe, you need to know where everything is at. So when I need a scalpel blade, when I need vet spawn, when I need suture, you know where it's at. You don't want this to be going on. I don't know. And you got blood hitting the ceiling and the dog's bleeding out. I don't know. I need a hemostat. I don't know. How often do we hear that, docs? Okay, you need to have somebody in surgery with you that knows exactly what's going on. Getting them trained is well worth it. And then, so basically, really, it comes down to just getting the team together, getting a whole team together. It's hard. I know. I'm not the rah-rah person. Stephanie knows really well. I hate to be like, oh, you did a great job, even though they screwed up everything. It's not going to be me. And then just do it yourself as a last resort. So what are some things, before I finish up here, what are some things that you guys can do that are relatively small that can really help yourself? Okay? Because again, buying stuff is going to have to come from the practice. Getting better, assistance, getting training, getting better equipment. It's all going to have to be the stuff that comes from that. Stretching. I told you this already. Stretching is a huge thing. Now, this is Isabella. Isabella is my Brazilian resident. She just started. And it was so amazing that, she was here when I was talking to them. This QR code, if you guys want to pull out your smartphones and look at it now or look at it when you get home, this is a link to all the ergonomic stuff, all the ergonomic videos that we just shot. And Isabella was here, and she was like, oh my God, ergonomics are huge. They're super important. And she goes, I was having severe issues, both my neck and my wrists and my shoulders were having issues. I went to a chiropractor, and the chiropractor taught me these stretches about how to do it. So she has one. Dr. Greer is going to do another one. When I was going online and looking at all the stuff that's available and all the different ways that you can improve yourself from a stretching standpoint, there's a thing on the human side. Again, this is coming from human hygienists that have a whole stretching routine. And so we are. And oh, by the way, if you guys did not get the quarterly, it's all linked from the quarterly. But Ashley and I, we just haven't had a chance to do it yet. Ashley and I are going to record the stretches that are in that. I think it's the California California Veterinary Dental Association that talks about all these stretches. But Isabella's should be up there now. All these resources are up there as well. It's a good thing. Exercise. One of the things they talked about in these articles was getting off your butt and getting outside for 5 minutes a couple times a day will make a huge difference as you're stretching, your posture, all that kind of stuff. So just walking, even just walking around the practice for a few minutes, getting out of the chair, changing your position of your life, making things, and then if you can, and in San Diego we can 362 days a year, get outside, walk around the block. That decrease of stress, that zen type fact that you can get just getting outside has shown to be a huge way to improve your ergonomics over time. And then I already said self-help training. I mean, if you guys are spending, 2 hours on a couple extractions and you're bent over this animal and it's just not coming out and you're struggling, again, remember, every second that you're working on this patient, you are damaging yourself. You are. Again, even with perfect ergonomics, perfect position, perfect magnification, perfect lighting, perfect equipment, which doesn't exist, okay? There's still an ergonomic price to pay for that. And so if you don't do that correctly, then you're going to suffer. And then most of us aren't anywhere near perfect, so we're suffering. So the least amount of time that you can spend in a dental procedure, whether you're a technician, you're an assistant, you're a DVM, the better it is for you and the better it is for your patient and your client. So training, I cannot stress that enough. The things that we have learned are the things that make everything better. So, in conclusion, how do we deal with this ergonomic stuff? Number one, familiarize yourself with the operatory and have somebody that is familiar with the operatory. Doctors find a go-to person. Technicians, be the go-to person. Be that lead technician. Be the ball. Be it, make sense. Number one, by far and away. If there's number one thing that, and again, this isn't Dr. Niemiec telling you this. This is all the studies that I've read. Magnification makes a huge difference. Lighting makes a huge difference. Proper chairs, proper table height, table extender can helpful. The organization goes back to the operatory. Good instruments, again, quality going back to care for the instruments. Stretching, exercise, training makes a massive, massive difference. Questions? Oh, come on.
Patient positioning.
Patient positioning. I think Dr. Skinner talked a little bit about patient positioning. All of our patients, as soon as they go under anesthesia, go into dorsal. They go into dorsal recumbency. As soon as they go under anesthesia, unless they're that big, deep-chested Doberman or Sighthound, then they kind of flop over side to another. Our patients go in dorsal recumbency, and unless we're doing a crown prep on a lower tooth or impressions or something like that, they stay in dorsal. They don't move. Their heads go to the side for X-rays of the maxilla, maybe, and for surgery on the mandible. But pretty much our patients go in dorsal and they don't move. And one of the main reasons for that is because when you rotate animals, you lose all your monitoring leads. You just do. And according to studies that I have read and talking to our anesthesiologist, when you rotate an animal, it's bad for their brain. There's something about the sloshing around in the brain. There's a long story I can tell you that I won't. But it's not good to move animals or people under anesthesia. It's also bad for their hips and back. okay, when they're rotated. So, cats, who cares, rotate them, they're easy. But big dogs especially, it's bad for their hips, it's bad for their backs, it's bad for their shoulders, it's bad for their GI. I mean, I don't know that anyone really worries so much about GDV with dentistry and rolling, but it's just not good for their brain, it's not good for their back, their hips, their shoulders, anything like that. My big thing with, rotating them into ventral is you lose all your monitoring leads. They just all come out, and then you worry about regurgitation. So yeah, dorsal. And if they want to go into lateral, that's fine. I mean, lateral is okay. I just really don't want to rotate them all that much. Anything else? Okay, so I told some of you this. All right, for those of you on Instagram Live, you're going to lose the really nice video audio because the audio doesn't come through when it's supposed to, which I have found out. So, some of you guys have seen me play before. Some of you guys have not. So I will tell you the very, 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 very quick story about this is that I have been wanting to learn the guitar and have been wanting to sing song parodies of my, now we'll see how this works. WebEx people, I'm sorry if this doesn't work very well for you. It may or may not, but I'm going to see how this goes. But basically, what I did, I thought, and honestly this was many, many years ago when I was in Mexico, I was teaching extractions. And I came up with this idea of you need to spend a certain amount of time, and if you guys want to record this, you're more than welcome to. But you need to spend a certain amount of time when you're elevating, at least 10 seconds, okay? So one of the things that I came up with was, well, you need to have a song to go through, and you need to talk about what we came up with was one of two things. It was either Happy Birthday to Me, sung twice. That's 10 seconds. That's how you long want to do it. Or it's Baby Shark, by the way. And so everyone's like, oh, Brooke, you come up with these songs. You should have songs that reinforce your key points. So the song that started it all, oh, by the way, ladies and gentlemen, if you do come to AHA next Friday morning, I will sing the song that started it all, which is Bye Bye Little Tooth That Has Died, which is to the tune of Bye Bye Miss American Pie, which, oh, by the way, is 50 years old this year. And Don McLean was here singing. I think it might have been last week that he was here. So it all kind of morphed into that. So I learned, it took me a while because people that I dated or whatever had talked me out of it. But finally with COVID, I wasn't seeing anybody, right? You weren't doing anything, weren't traveling anything, so I learned the guitar. And I'm not good, I'm not. I've been playing guitar for about 2 years now, a little over. And when I did, if any of you guys saw, and one of our stars is here, the thing I did for AHA, the YMCA, and if it's not, it's on our Instagram page, so if you want to check that out, it was fun. But I realized my ex-girlfriend had told me how hard it is to play guitar and sing. She was right. It's really hard to play guitar and sing. And that's why Bono, Mick Jagger, all these big, Taylor Swift's an exception. Most lead singers of big bands don't play an instrument. I mean, they do, but they don't play when they're singing because it's really hard because you got to concentrate on what you're doing here. So when I did that thing with the YMCA, I was like, wow, it was really kind of nice just singing. So what I did is I figured out a way that I could have backing music and some guitar and some singing and the video. So this has been, over the last couple months, a very interesting way to make all this happen. So again, to those of you guys that are on WebEx, I'm really going to apologize because you're not going to get this, so maybe you want to go to Instagram Live. Those of you that are on Instagram Live, I hope this comes out, and I hope you can hear me well, but this has been one of those things that has been kind of fun to deal with, and we're going to see. So this is kind of the goal of what we're going to do. Let's see if this is going to play. Oh, it's not going to play that, is it? No. Hold on for a second. Scott. Because I think that this needs to be plugged in. Oh, don't do that. Okay, so we're going to see if this works. Okay, work before. 2 seconds. I think what I did is I turned off our speaker. Hey guys, I'll be right back. Now I have to make sure that this is going to play. That's going to work. So now we just need to make sure. No, stop. Now I have to get my audio. There we go. All right, now, if it wasn't for these darn people that are on WebEx, we wouldn't have to deal with this. Okay, now we got it. Ugh. Sorry, WebEx people, I love you. I'm not good. I can promise you I'm not good, but I have fun. There we go. Come up here so they can hear me. All right, first time. Welcome to the jungle. It's not fun games. We can't find anything you want. Honey, we don't know the names, but there are people that can find whatever you may need. If you've got the patience, honey, you can treat the disease in the jungle. Welcome to the jungle. It can bring you to your knees. It might make you bleed. Welcome to the jungle. You take it day by day. If you're not careful, you may bleed, but that's the price you pay. But if you're a patient girl and who's not hard to please, you can get the bright lights, but you won't get them for free in the jungle. Welcome to the jungle. Beware my serpentine. Oh, it might make you scream. Welcome to the jungle. Gets worse here every day. It's hard to treat an animal in the jungle where we play. But if you got a need to take it eventually, you can get anything you want, but you may not get it free in the jungle. Welcome to the jungle. I'm gonna bring you to your knees. Oh, it might make you bleed. When you're high, you have to come down. So down. There you go, there's a fade. You know where you are? You're in the jungle, baby. You're gonna cry in the jungle. Welcome to the jungle, gonna bring you to your knees in the jungle. Welcome to the jungle, gonna bring you to your knees in the jungle. Welcome to the jungle, gonna bring my serpentine in the jungle. Welcome to the jungle, don't let it bring you down.